This is an in-service training program presented by Nutrition Care Systems. Today's topic, mechanically altered diets. Today's learning objectives are number 1, understand the reasons for texture modification. Number 2, identify the texture modifications used in healthcare. Number 3, describe correct textures of texture-modified diets. Number 4, understand correct preparation of texture-modified diets. Number 5, understand what type of resident requires a mechanical soft diet. Number 6, describe the types of foods to avoid on a mechanical soft diet. And number 7, identify the definition and warning signs of dysphagia. What are some of the reasons for modifying the texture of the diet? One would be chewing problems, whether it be poor dentition, missing dentures, missing teeth, sore mouth from illness, surgery, dental work, or chemotherapy, and then swallowing problems such as dysphagia might result from a stroke, diseases like Huntington's or Parkinson's, cancer, or radiation therapy. Keep in mind too that texture modifications may only be temporary, not a permanent change, depending on what condition is causing the dysphagia. The most common modifications that you're going to see in healthcare as far as diets would be a puree diet, mechanical soft, and a regular diet. So we'll talk a little bit more about these particular diets. So a puree diet should have the consistency of like a soft mashed potato. It shouldn't be too runny. It should almost be like a pudding-like consistency. Mechanical soft, those are foods that are going to be moist, soft in texture, and easily formed into a bolus. Examples of that would be like a soft canned or cooked fruits, ground beef with moisture like gravy or some kind of sauce, and then well-cooked pasta. And then depending on chewing ability, meats may have to be finely ground, almost like to a breadcrumb consistency, or chopped into small pieces for a level 2 or level 3 diet. So again, that puree diet should have that mashed potato or pudding-like consistency. It shouldn't be too runny or liquidy. They should be properly seasoned. Puree food should taste the same as a regular diet. They should have the same amount of salt, pepper, herbs, spices that a regular diet would have. Blender or food processor is typically used to get that just right, proper consistency. You don't want to have any chunks in there. You want to have it all nice and smooth. Preparing your puree food, you may need to add additional liquids such as milk or broth or a thickening agent during your preparation to get that proper consistency. Now there are already commercially prepared puree foods that are available, and they provide a puree food that's formed in the shape they originate in food. For example, chicken is actually formed into a chicken breast. Next, we'll talk about mechanical soft diet. So basically, you're going to be chopping or grinding the items on that meal, and otherwise, little special preparation is required. So all the foods have to be well cooked, and any hard, fresh fruits or vegetables or any other hard foods need to be avoided on a mechanical soft diet. So what kind of resident would require a mechanical soft diet? Really anyone who has any limited chewing or swallowing abilities, but maybe they're able to tolerate more variety and texture of foods than a puree diet would offer. Maybe someone who's undergone head and neck surgery, or someone with dental problems, or someone with an anatomic esophageal stricture. And again, mechanical soft could be temporary, doesn't necessarily be a permanent change, but again, this is the type of resident that may require this type of diet. So some of the foods you want to avoid on a mechanical soft diet: raw fruits and vegetables, nuts, seeds, and any dried fruits. These could cause issues with choking, so you want to make sure the resident avoids these particular foods. So what is dysphagia? Dysphagia is the disturbance in the normal transfer of food from the mouth to the stomach, and that can result in difficulty swallowing liquids and or solids. And remember, we talked about that can be related from a stroke or Parkinson's or Huntington's. Can be a temporary situation, but also could be permanent. Here are some warning signs of dysphagia, and obviously the speech therapist will be very involved with someone who has any kind of issues related to dysphagia, but collection of food under the tongue and cheeks or hard palate, spitting food out of the mouth, tongue thrusting, poor tongue control, more than usual tongue movements, slow oral transit time, a delay or absence of elevation of the Adam's apple, coughing before or after swallowing. We see that a lot in long-term care, and then choking. Obviously, that would be a sign of dysphagia. Some other signs would be excessive mouth secretions or drooling from the corner of their mouth, gargled voice after eating or drinking, maybe unexplained weight loss or prolonged feeding time, or inadequate food or fluid intake. Mealtime resistance, maybe they're clenching their teeth, pushing the food away, clutching their throat. They just don't want to eat because they're afraid they're going to choke. So here's a list of some of the food groups and items that you could have on a mechanical soft diet, and then the items that should be avoided. Under beverages, milk, malted milk, milkshakes, coffee, tea, that's fine, but anything containing raw eggs may cause distress. Under breads, things recommended would be soft breads, pancakes, muffins, soft waffles, but want to avoid anything with seeds, nuts, or dried fruits. Desserts, any plain custards, puddings, sherbet, ice cream, fruit-flavored ices, or frozen pops would be good, but avoid anything with coconut, seeds, nuts, or whole or dried fruits. As far as the fat food group, it's recommended butter or fortified margarines, creams, cream substitutes, cooking fats and oil, gravies, whipped toppings, salad dressing. Anything else may cause distress. Fruits, anything canned or cooked, chopped fruits without seeds or skins. Fruit juices are fine. Anything else, again, that's raw might definitely cause a problem. Meats and meat substitutes, ground meat and poultry, gravy or sauces should be added to make it more moist. Soft flake fish without bones, casserole made with ground meats. Any raw eggs or eggs cooked less than 7 minutes should not be offered on a mechanical soft diet. Any kind of whole cuts of meat. Potato or substitute mashed or creamed potatoes, rice or noodles. Anything else may cause distress. So soups, you want to stay with more broth or bouillons. Stay away from anything with large pieces of meat or vegetable. Sweets, clear jelly, honey, sugar substitutes, syrup, fine, but anything with coconut, nuts, or whole or dried fruits needs to be avoided. Vegetables, they should be well cooked, soft vegetables without skin or seeds, and really any other raw vegetable needs to be avoided. Miscellaneous seasonings like salt and pepper, ground spices, smooth condiments are good, but again, avoid nuts, coconut seeds, and olives. Let's take a short quiz. Question number 1, which of the following is a reason a resident might need a texture modification? A, missing dentures, B, oral cancer, C, neurological disease like Huntington's disease, or all of the above? The answer to question number 1, which of the following is a reason a resident might need a texture modification? The answer is D, all of the above. Whether it's missing dentures, oral cancer, neurological disease, or no teeth at all, those would be reasons that a resident would need a texture modification. Question number 2, what is the proper consistency of a puree diet? A, melted ice cream, B, pudding or mashed potatoes, C, dry breadcrumbs, or D, none of the above? And the answer to question number 2, what is the proper consistency of a puree diet? And if you remember, we talked about pudding or mashed potato consistency. Remember, you don't want it too thin, but you want it the consistency of mashed potatoes or pudding. Question number 3. What is not a warning sign of dysphagia? A. Coughing, B. Rash, C. Choking, or D. Unexplained weight loss? And the answer to question number 3, what is not a warning sign of dysphagia? B. Rash. Remember, we talked about coughing, choking, unexplained weight loss. Those were 3 of the many warning signs of dysphagia. Question number 4. Sweet rolls with nuts should be avoided on a mechanical soft diet. True or false? The answer to question 4 is true. Sweet rolls with nuts should be avoided because the nuts could cause choking, so we want to avoid any nuts or seeds on a mechanical soft diet. And our last question, number 5. Plain custards and ice cream are an excellent dessert choice for someone on a mechanical soft diet. True or false? And the answer to question number 5, true. Plain custards and ice cream are a great dessert choice for someone on a mechanical soft diet. Thank you for your participation in today's program. Our goal is for you to use this information in your daily work. We hope you are well served today and every day. If you would like more information regarding our in-service training programs or our consulting dietitian services, please contact us at Nutrition Care Systems, 1275 Davis Road, Suite 121, Elgin, Illinois, or visit us on the web at nutritioncaresystems.com.